From the PEP Radio Newsroom, this is part two of a two-part story from The Advocate about gender-affirming healthcare and one very large healthcare entity in Ohio. The Department of Justice wrote in a press release that the settlement with the Cleveland Clinic follows a similar case it settled with a Texas hospital last month. The state of Texas accused the hospital of billing Medicaid for illegal gender transition interventions, including by using false diagnosis codes, the Texas Tribune reported. As part of the agreement, the hospital had to fire 5 physicians who provided gender-affirming care, pay the state $10 million, and create the country's first detransition clinic, which would support individuals who are stopping or reversing the process of transitioning between genders. The care would be free to patients for the first 5 years. Detransitioning can take many forms, from changing one's name to halting hormone treatment to reversing previous surgeries. It is rare for people to regret transitioning after taking hormone therapy and surgical interventions. Between 1.3% and 2% of transgender people report dissatisfaction or regret over seeking gender-affirming health care in their lifetimes. The Cleveland Clinic settlement does not appear to go as far as the Texas settlement. It asks the hospital to commit $2 million in detransition care, which can include care provided to both insured and uninsured patients. Uninsured and underinsured patients can qualify for reduced cost or free detransition care under the hospital's existing financial assistance policies. The dollar figure isn't what we are obligated to pay, rather a commitment of care to patients who want this service, which we already do. A hospital spokesperson wrote in a statement, it did not clarify what detransition services the hospital already provides. The detransition services at the Cleveland Clinic is supposed to provide under the agreement include medical care for hormonal balancing, endocrine care, surgical revision and reconstruction, fertility restoration, psychological support, including grief counseling, and insurance coordination for residents who underwent sex-rejecting procedures before age 19. These procedures don't include psychiatric or psychological treatments like talk therapy. As part of the settlement, the clinic agreed to use, quote, its best efforts to inform the public regarding the availability and accessibility of detransitioning services. That includes a dedicated webpage, a dedicated phone number, and a dedicated care coordinator, which the hospital agreed to have in place within 30 days. Detransitioning services were always a part of gender-affirming care, said Atkinson of Trans Ohio. There continues to be no increased need, and it is a bigoted, sad, performative farce the clinic is choosing to promote. The clinic didn't respond to Atkinson's comments. Go figure. The Republican supermajority in the Ohio legislature passed the SAFE Act in 2023, an Ohio law banning all types of gender-affirming health care for transgender minors. Governor Mike DeWine vetoed the bill, but Republican lawmakers cut short their winter vacation to override the veto. May they suffer more lake-effect storms in the north. The Supreme Court of Ohio heard oral arguments on March 24th in a lawsuit challenging the SAFE Act. In April 2024, a common pleas judge put the ban on gender-affirming care on hold with a temporary restraining order after the American Civil Liberties Union of Ohio filed a lawsuit on behalf of 2 transgender girls, Madeline Moe and Grace Go, at risk of losing access to health care under the SAFE Act. Yost, former Ohio Attorney General who resigned in disgrace, filed an emergency motion to block the restraining order, which the courts granted, meaning that gender-affirming care for minors remains banned pending the outcome of the Ohio Supreme Court case. With that said, Ohio is simply not a safe place to be. It never has been for LGBTQ plus people. If you want a safer state, move to New York or Pennsylvania or Vermont or Massachusetts or Connecticut or Rhode Island. Any of those would be safer than being in Ohio. If you are stuck in Ohio, seek help from one of the resources available, such as Equality Ohio or Trans Ohio. That's our coverage of this story. PEP Radio is available on the Live 365 app, the PEP Radio page at paequality.com, Roku, Alexa, and wherever you find streaming radio. Up next, we have the Meadville area weather forecast here on PEP Radio.